Hello, good morning, good afternoon, and good evening to everyone around the world following the Unite Global Summit 2020. It is a true honor as founder and president of the Unite Global Network of Parliamentarians to End Infectious Diseases to welcome you to our first global and this time virtual summit. So special greetings to all of the representatives, parliamentarians, representatives from Congresses, Senates, and Parliaments from around the world, our esteemed colleagues, especially those that are members of the Unite Network. Special greet also to all of our sponsors and collaborators and partners, and a special greeting also, and thank you to my two special guests in this opening session, my dear friends, 𝗕𝗽𝗻𝗂, the UNAIDS Executive Director. Thank you so much for finding the time to join us today. And Martin Chungong, Secretary General of the Inter-Parliamentary Union. Thank you also for joining us today. This is the opening session of what will be a two-day online conference, on which we will have around 1,000 participants joining us. And I would like to leave a few words at the beginning of this summit to give you some context of about Unite, how this summit came about, what to expect over the next 2 days, and most importantly, what we expect to do after the summit is over, the day after. How are we going to help change the world? And in that sense, I'd like to let you know that back in the days when I was a junior physician, as a medical doctor working in an infectious diseases ward here in a hospital in Lisbon, I finally encountered a reality that despite over a decade of training in medical sciences, and before that, my teenage years as a volunteer, I met a reality that I had never seen before. A reality of how we are capable in societies of excluding, of keeping people at the margins of society, while dealing with people living with HIV/AIDS, with viral hepatitis, tuberculosis, dealing with the challenges of antibiotic resistance, of tropical and neglected diseases, as my hospital worked with many of the former Portuguese colonies, and also dealing with pandemic threats, as one can remember back in H1N1, and at the time I was working in the intensive care unit. And all of that molded the way I personally was looking at infectious diseases. And it changed my perception about what we call now the social determinants of health, how poverty, how hunger, how inequalities at large have a tremendous negative impact on people's lives, and how that influences infectious diseases and our global health response. And that led me, in a way, to do my internship at World Health Organization, where I worked deeply in terms of social determinants of health. And following that, I ran for Parliament. And I was fortunate enough, as I ran for Parliament in 2011 for my first term, as soon as I was elected, I had the opportunity to work with patient advocates and associations that supported me from day one. And this was a time of tremendous financial crisis. And we were able to work together, NGOs, community-based organizations, the scientific community, and of course, parliamentarians from all parties, because this is a cross-party theme. We were able to avoid the negative consequences of infectious diseases within the financial crisis. And we were able to keep on track to our goals from everywhere, from HIV to TB, viral hepatitis, and so forth. And this was our demonstration from Portugal that it is possible to do more dealing with these issues. There were other tremendous challenges. Portugal, we are fortunate to have, for example, a very progressive drug policy where we are one of the first countries in the world to have decriminalized drug use, but we still face challenges even in terms of drug policy or among sex work. So there are challenges still to be faced. And of course, most recently, we have been facing those challenges related to COVID-19. But I'll get to there in a second. Because I want to still step back 3 years when in 2017, we then decided to create Unite, the global network of parliamentarians. It was building up on this sense that actually parliamentarians can make a difference, that parliamentarians can change budgets, they can change laws and policies, keep governments accountable, being at that interface between the people, the real people, and political power. And it was bringing together this spirit of change and understanding that parliamentarians were not as involved as they should in the transformations needed, as we have seen in the role of governments or civil society organizations, that we created this network to join forces. Because underlying the social determinants of health are the political determinants of health. We know today very clearly that evidence-based, scientifically based policies save lives. Evidence-based policies can make the difference between people living or dying. And as a network of parliamentarians, we are capable of having the support to make sure that we make the right policy decisions and we create the human connection among ourselves so that we can share our best practices and hopefully do a better job in serving the people and serving our nation's interests. That being said, we understand and we acknowledge the role of all partners in society. We cannot do this alone. And that's why we are so grateful to have been able to create this network that now marks 3 years of its existence because of the support of organizations like UNAIDS and the AIDS Healthcare Foundation, which have supported us from day one and still continues to support us today. And this summit, as we're seeing, we had organized multiple events in the past, but this is the first time we gather all of our network together in one space. We hope next year to be able to do this in presence. But the virtual presence is strong enough for us to feel the passion and the hope that all of our partners and participants and members are feeling moving forward. Because COVID-19 has brought upon us tremendous challenges and has, in a way, tried to pull us apart. But we've seen in society the good. We've seen that people react positively when given the right tools. And that is what we are aiming to do here, to discuss throughout this summit many of the hot topics that and discussions that we are facing, to see if we can respond more actively and proactively to the challenges that we are facing. We will be seeing throughout these 2 days the lessons learned over these first 6 months of COVID-19. How can we respond better today, tomorrow, and years to come to future pandemic and global health threats? We will be looking also to other aspects, like, for example, malaria and its relations to COVID-19, and in that aspect, thinking about tropical diseases and neglected diseases. HIV/AIDS will, of course, play an important part in our summit, looking at, of course, correlated conditions where we need to have a holistic view. We know today very clearly, and that is a part of the Unite spirit, that we need to have a holistic view and not a verticalized approach. And so HIV, viral hepatitis, tuberculosis, understanding the interconnections, the synergies, and the potential actions that we can have to respond better. Looking at integration of care, the continuum of care, and of course, specific issues like, for example, harm reduction and drug policy, which have been very close to Unite's heart since its beginning. And also, of course, the response, the urban response, how cities can respond better to HIV, and we will have a special focus on fast-track cities. But also, we will have a discussion around the role of innovation and understanding how the innovation will support our response to global health within COVID-19, but also beyond it. How can we use innovation more intelligently, and how can we integrate that within our policies? And of course, the Global Public Health Convention, which is going to be an important part of our second day of our summit, very much led by our sponsor, AIDS Healthcare Foundation. And their president has been known to say many times, and he'll probably remind us, that if global health if air traffic control were to be managed the way we can manage global health, we would probably have an aircraft disaster every 5 minutes. There is a lot of work that needs to be done, and hopefully in that panel we will be able to focus on what we need to do better to be able to respond more actively, more effectively in the future to similar threats as those that we are facing today. And we will end this summit presenting a statement that will be signed on by our partners and, of course, by our members. And I'm very honored that our Unite chapter chairs from around the world will be joining me to present this statement so that you will be able to meet the chapter chair of your own region, the MP, the member of parliament, or senator or congressman, who is clearly working in your region to put Unite's effort at the top of the agenda of every nation in that region. And this has only been possible to bring everyone together because we have an extraordinary team at our secretariat, led by Victoria, with Amish and with 𝗨𝗡𝗂, which many of you probably have met, and a whole bunch of collaborators who have joined to build up this summit. It's a small team, but very passionate, and without them, we wouldn't have been able to put this together. So I'd end my opening statement by saying that we know what needs to be done. We have the knowledge and many of the tools that are needed to end infectious disease as a global health threat. And to do that, given the times of peril, of the challenging, dark times that we will have ahead when it comes to social and economic policies, we need to make sure that Sustainable Development Goals continue to be our lighthouse moving forward. We need to make sure that we do not leave anyone behind. And if COVID-19 brought anything good, it is showing that global health has to be front and center of international development and of all social and economic policies at a multilateral, but also at a national level. And to support the efforts of nations to respond to people's need on the ground, we at Unite will continue to work with our members to make sure that we end infectious diseases as a global health threat. It's time to unite. Thank you very much for joining us these 2 days. And having said that, I'm now very honored to be able to present the following speaker, who is, as I mentioned before, the executive director of UNAIDS, as I mentioned, a very strong supporter from day one of the Unite Parliamentarians network. We are tremendously honored to welcome you, former Oxfam leader and now the UNAIDS executive director, our dear friend, 𝗙𝗍𝗂. Thank you. The floor is yours.
Thank you very much, Chair. Can you hear me? Yes, you can. Well, the Honorable 𝗪𝗏𝗪𝗏𝗪, Member of Parliament and founder and president of Unite, members of Unite, members of Parliament, my colleague, my friend for many years, President of IPU, Martin Chungong. Yeah, I'm so pleased, and I thank you very much for inviting me to be at this panel. I want to congratulate you on organizing this important summit and bringing us all together, uniting us. It's a critical moment. The world has been disrupted, and the poorest, the weakest, are being hurt the most. Coronavirus is disrupting the world in such a way that it's widening already existing extreme inequalities. I want to speak to you parliamentarians in your three of your capacities. First of all, I want to speak to you as a global coalition of parliamentarians with a global voice, so your advocacy role. I want to speak to you on how you can use your power of the purse. This is such an important part of your functions, the power of the purse. Then thirdly, I want to speak to you in your legislative capacity. Three areas where I feel you can play an important role in turning this pandemic around and pushing for strong, inclusive recovery. Let me start here. We cannot afford, the world can't afford to make the mistakes from the early AIDS response. When we saw people in rich countries being treated first when antiretroviral treatments were found, whilst millions of people in poor countries were left to wait in the line and to die. You know, as an African woman, I saw this with my eyes. I buried some of the people who didn't need to die. Many of those didn't need to die. I mourned with their children. I raised many AIDS orphans. I still do. We are still living with that legacy of having treatments that were availed for some and not for others. That is why it's so important that you parliamentarians join this call that is growing around the world to support what is now called a people's vaccine. Together, and let me first go back. Why was it possible for a treatment to be available for some and for others to continue to die? It was because of the monopolistic approach to intellectual property that is allowed, that is set within the rules, and that puts profits before the lives of people. So, myself, together with leaders of countries like Indonesia, Pakistan, Senegal, South Africa, together with civil society organizations, including Oxfam, which I used to work with, we mobilized that this does not happen again. We pulled together a petition of more than 150 experts, including more than 52 former world leaders, and we launched this campaign of a people's vaccine. The Secretary General has endorsed it, Secretary General of the United Nations. We need to ensure that if a vaccine is found, as indeed we are seeing many vaccine candidates in the late stages of development, everyone should be reached, and it should be free of charge at the point of use. Only mass simultaneous production using all possible manufacturing capacities across the world can ensure the levels of production needed. No one producer can match that scale, even if they are generous and make donations of doses here and there. Countries with leverage as public funders of R&D need to demand that their companies, because they are receiving public money, share their technology in a way that maximizes the public good. They should share all knowledge, technologies, and intellectual property through the WHO COVID-19 Technology Access Pool. We need all to sign up and support all the global initiatives to develop and ensure equitable access to treatments and vaccines. There is also something called COVAX and the Equitable Access Framework, also led by WHO. We want to see all countries and their companies play within these global mechanisms that can ensure that everybody gets life-saving vaccine at the same time and free of charge. Your leadership in advocating for the values and principles underpinning the people's vaccine is critical here. I urge you parliamentarians to get on board, to make the resolutions in the UNITED Forum and in other forums and join the mounting pressure for a people's vaccine. 2, healthcare. Healthcare is a human right. It should not be a commodity for sale, and it should be a right for everyone in every country, and it should not be that the money in your pocket is what decides whether you're healthy or not, whether you live or die. But across the world, we have regressive health financing strategies which rely on user fees, and these evidence is so clear that they increase poverty and they widen inequalities. Today, the World Bank has estimated that 100 million people are forced into poverty as a result of out-of-pocket healthcare costs every year. Every year. This is an estimate by the World Bank before COVID. Now we are seeing many predictions of millions of people being pushed back into poverty, and lack of healthcare is one of the reasons. In Africa, we know that at least 40 countries are charging user fees for healthcare, charging them to very poor people. So 10,000 people every day die. Today, 10,000 people will die because they couldn't access healthcare. COVID has demonstrated very clearly, never before has it been so dramatically demonstrated, that there is a tight link between the health of people and the health of economies. It has been a false economy of looking at health as something to sell to people, not as a prerequisite for human rights and for the growth of economies and for the safety of everybody. So, where's your help? Where's your role here? In my humble view, your power of the past is a critical entry point for you to defend and ensure that health budgets survive and are increased even during this economic crisis. How can this happen? One of the ways is really to ensure that today a global corporate tax reform happens that will ensure that all our countries, particularly developing countries, can raise the domestic revenues that are due to them, that all the tax loopholes that exist today and the harmful tax competition that forces them to reduce corporate taxes down even to zero, that this stops and enough resources can be raised to fund healthcare, education, and other human rights. So I urge you again to join a call for a global corporate tax reform. Remember that some tax reform happened during the last global financial crisis. Why? Because rich countries realized they needed to raise more revenue from companies, particularly digital companies. But they didn't go far enough to help developing countries also to mobilize all the resources they need from the production in their own economies. So you have a role there. Equally, debt. The least able countries, the low-income countries to address the pandemic are being strangled by debt today. To give an example, Zambia has in the last 4-5 years been increasing its debt repayments by 760% while cutting healthcare by 30%. That's between 2015 and 2018. This is the trend in many of the low-income countries, even some of the lower middle-income countries. The situation of debt does not allow them to recover or even to fight. They don't have a fighting chance with this pandemic with that level of debt. The debt service, the debt relief that has been granted doesn't go far enough, deep enough, or long enough, the debt relief. So we need to see debt cancellation, and this is not in any way to harm the credit worthiness of these countries, but it is critical for the survival of people, lives, saving lives. Also, for the international financial institutions and the big countries to allow the creation of special drawing rights to increase fiscal space for the low-income countries and middle-income countries. These are within your means to demand for, as well as using their power of the past to maintain health spending. Lastly, on your legislative role, members of parliament, you are the custodians of the human rights for your citizens. And you must never forget that a pandemic is not just a health issue. Everything we have learned from HIV, from fighting HIV, 25 years of this organization, we have shown the world that human rights are central in fighting an epidemic, a pandemic. That when the human rights of certain groups of people, of women, are not realized, then those groups of people can never access the benefits of science. Whatever treatments, vaccines, tests you have, as long as people are being driven away, driven underground because of denial of human rights, then you cannot have an end to a pandemic. So I urge you, this is the time to repeal all those laws that discriminate against people, against certain groups of people. You need to make laws that end stigma, but not those that increase stigma. You need to make laws that ensure equality of rights for all people. We are seeing violence against women and girls increasing in the context of lockdowns. It is time for you to strengthen those laws and put money behind the implementation of laws to against violence against women and girls. These are some of my suggestions, recommendations to you as parliamentarians. I end by congratulating you very much on organizing this summit and coming together to raise your voice as leaders of the world. Your global role as advocates, your power of the purse, your legislative role put you in a very powerful position to help to end this pandemic and to aim for a strong, inclusive recovery that resets the global economy so that it benefits all people. I thank you so much.
Thank you, Madam Executive Director Winnie. We do take your words very seriously, and the call to action in a way in terms of the people's vaccine, but also in terms of tax reform and debt relief. That's an issue that I think will be very interesting on the second day with the chair, our good friend and chair of the World Bank and IMF Parliamentary Network, 𝗨𝗡𝗏, who will be joining us, a partner network with whom we work on international development and the reform of financial institutions, and its response in this time of crisis is of critical importance. So thank you so much for your inspiring words. And without further ado, I'd like to present the last speaker of this opening session, our dear friend Martin 𝗏𝗏𝗏, who actually made double history in 2014 as he became the first African and non-European to become Secretary General of the Inter-Parliamentarian Union. Thank you for joining us, Martin. The floor is yours.
Thank you very much, Ricardo. Thank you for inviting me to this very important summit. You've said that this is the first summit, and I think that it holds a great promise for mobilizing parliaments in support of global efforts to fight infectious diseases. I would also like to greet my very dear friend, Winnie Byanyima. We haven't seen each other for some time, but I'm pleased to make contact with you virtually. Hope we'll see you one of those days. Honorable members of Parliament, it gives me great pleasure, therefore, to address this important summit. And indeed, as the previous speakers have said, we think that COVID-19 has shown us once again how an invisible pathogen can change the world's course of action and impact the lives of each and every one of us. But we should not forget that other infectious diseases continue to have devastating consequences for millions of people worldwide, while climate change contributes to the emergence of new health threats. This is why the topic of this very important summit is so relevant today, because it is going to help define and implement the promise held for the Sustainable Development goals when it comes to addressing communicable diseases. We also often hear that COVID must be an opportunity to build back better, to scale up efforts towards a carbon neutral economy, to invest in health systems, and strengthen multilateralism. The Inter-Parliamentary Union is a strong promoter of this view. Last month, more than 115 speakers of Parliament came together virtually at the 5th World Conference of Speakers of Parliament to reiterate their commitment to robust parliamentary action for a safer, healthier, and more prosperous world. Each one of us parliamentarians is responsible for this course correction, the only one that can give us hope for the future. However, I must ask, have we finally learned the lesson? We already have all the instruments. The 2030 Agenda for Sustainable Development is the most ambitious agenda to end poverty and ensure people's well-being and safeguard our natural environment. The current pandemic is a setback in the achievement of the SDGs, but even before then, progress was not enough. And not enough means that people are hungry, ill, unable to attend school and get decent jobs, victims of violence and discrimination, and dying. In 2019, the 179 member parliaments of the IPU adopted a landmark resolution on universal health coverage. And I believe, Winnie, this speaks to the concern you raised regarding the inability of people to access health care because health care is prohibitively expensive. The resolution, therefore, recognizes the link between universal health coverage and global health security and calls on parliaments to prevent the spread of diseases through immunization, strengthened surveillance systems, and the full implementation of the international health regulations. It also has a strong focus on women, girls, and vulnerable groups, urging parliaments to respond to their specific needs, including on HIV/AIDS. This resolution and other instruments exist and testify to the commitment of governments and parliaments worldwide. So why are we lagging behind? Why are we not living up to these promises? If we do not answer these questions, the opportunity of COVID-19 will be another empty promise. What is preventing bold action in the interest of the people, especially the most vulnerable and marginalized? And how can we demonstrate leadership and build solidarity to work together for the greater good? Honorable members of Parliament, ladies and gentlemen, parliaments must be at the center of the response to the COVID-19 pandemic and the ensuing economic crisis. And there, I would like to echo what my dear friend Winnie has just said in terms of helping to reduce inequalities brought about or exacerbated by the current pandemic. Parliaments have the great responsibility of representing the people who are affected by COVID-19, the ones who have lost their livelihoods, and those who are still facing challenges in accessing health care. But an even greater responsibility is that of understanding how political action is affecting them. Science is working hard to provide the scientific response to prevent and treat COVID-19 and other diseases. But it is the political response which is shaping the trade-offs between individual freedom and collective protection. It is decisions on resource allocations that determine what sectors and groups are to be prioritized, and negotiations at the international and national levels will be guiding distribution of a vaccine. The oversight function of parliaments has never been so important, and we welcome the capacity of parliaments to innovate and continue functioning in these challenging circumstances. The Inter-Parliamentary Union continues supporting parliaments to exercise their democratic mandate, and our campaign, Parliaments in a Time of Pandemic, is collecting valuable information on how they operate during COVID-19. We learned, for example, that in Tanzania, 40% of all those allowed to take part in the business of parliament during the crisis need to be women. In Sierra Leone, parliamentarians visited their constituencies to sensitize people on measures to prevent infection, while in the United Kingdom, the Parliament announced an inquiry into the human rights implications of the government's response. We also keep working with our partners like UNAIDS, and I look forward to discussing avenues of strengthening our cooperation with WINI and UNAIDS. And we also continue to work with the World Health Organization to empower parliamentarians and strengthen parliamentary institutions. This means promoting equal representation of men and women and political participation of youth for more inclusive decision-making. It also means reiterating the centrality of the SDGs as the global framework for addressing the pandemic and implementing recovery plans that deliver social and environmental sustainability. I am looking forward to the next 2 days of deliberations, and I'm confident that we can together identify and agree on concrete steps that parliaments and parliamentarians can take to address communicable diseases. My call to you is, let this not just be another opportunity. Let's make this the time for real change. I wish you a very successful summit. Thank you.
Thank you very much, Martin. It was a great speech, and we take your words very seriously on how we need to make our Parliament's response robust, focusing on carbon neutral economy and strengthening the health system. And we take in also your words on how we need to work more on preventing disease and preventable disease. At the end of the day, I think this closing session is calling on also for a new economic order, focusing on the well-being and health of all people. And I think this is a very strong message to end this opening session. I thank you both, Winnie, Martin. You have been fantastic partners throughout the years, and I'm sure we will continue to work together. And this is the closing of our opening session, calling everyone to unite, especially now these 2 days as we bring together brilliant minds to discuss the challenges ahead. I'm going now to pass the floor to my esteemed colleague at UNITE, Victoria Gransholt, the Executive Director of UNITE, and she will then transition us to the first panel session, which will be focusing on epidemics and what are we learning from the global response to COVID-19, which will be moderated by our good friend, 𝗕𝗫𝗄 Fitzgerald. Victoria, the floor is yours. Thank you.
Hello, everyone. My apologies for the technical difficulties. I seem to be having some mic issues, but okay. Without further ado, I know that we are a bit delayed on our sessions already, so I will be very quick so we can move on to our next exciting panel. I simply want to welcome all of you to this exciting first Global Summit. It is a flagship event for us, and without our partners and members in the network, it would not have been possible. Currently, the UNITE network has more than 130 current and former members of parliament across 63 countries, all who are committed in ending infectious diseases as a global health threat through unified political action. And that is what this summit is all about. Please feel this event as yours as we welcome everyone to engage and interact with one another. There is a networking area on the platform that allows you to connect with colleagues from around the world. To the policymakers in the meeting, I encourage you all to engage and meet your partners who are leading efforts across the different priority disease areas. We also will be live tweeting highlights of the event throughout the 2 days, so please feel free to use the official hashtag of the summit and tag us, the speakers, and partners to showcase your participation. We also encourage you to utilize the chat feature on the right-hand side to submit questions, as each of the panel sessions will have time allocated for question and answer. Throughout these 2 days, you will see firsthand the work that is being led to address the COVID-19 response and beyond. This is an opportunity to unify and reinforce the global solidarity needed to achieve a more sustainable future. With 10 years ahead to achieve the 2030 United Nations Sustainable Development Goals, we must work together. We hope that you will find the Global Summit as an interface not only to learn from experts in global health, but to facilitate this collaboration for change. So thank you again for joining us today. And just quickly before we transition to our first panel, I will just make a quick break to allow them to transition on the stage. I know that we are a bit behind, so we will be back here just in a few minutes. So I see you right back here shortly. Thank you.